Hey, aloha gang, Dr. Russ Rosen here. Let me ask you a question. Have you ever had a patient tell you that they wanted to reduce their care before you would recommend? So they're at twice a week and you're gonna recommend they stay at twice a week, but they want to go to once a week, or they're at once a week and they want to go down to once every 2 weeks or once a month. Yeah, sure, we have it all the time. I literally just got off a coaching call with a doctor who said, what do I do? I mean, the patient just said to me that she wanted to go down to once a week, and I think she needs to stay at twice a week, and I just didn't know how to respond to it. So thought I would just make a short video in case it helps you out on this. Here's the two classic blunders. The two classic blunders when they say to you, hey, I want to go ahead and reduce my care, or can I reduce my care? The first blunder is to say yes. And the second blunder would be to say no. Those would be the two classic blunders. And here's why. Because we're simply giving an answer like, yes, you can reduce your care. They can, but are they still going to get the same results? No, you can't reduce your care. Well, of course I can. Like, I just don't have to show up. You don't have a gun to my head, right? So the truth of the matter is when they ask that question, I need to use LASER. We use this acronym called LASER, which is listen, acknowledge, ask, solution, and resolution. So I'm listening to them, and I need to acknowledge, I need to take the wind out of the sail. See, they may be stressed that they need to say to you, hey, I want to reduce care, because they don't want to get berated by you, right? All kinds of different things could be going through their mind. So I just want to acknowledge it and say, yeah, sure. What's going on? So when I acknowledge it, I can say, sure you can, because they can. Or I could say, oh, I see that you wanted to reduce your care. What's going on? However you want to acknowledge it, but I want to de-escalate the situation. I want to take wind out of that sail. My favorite thing to do when they say, hey, I wanted, can I go ahead and reduce my care? I just say, sure you can. You can. Let me ask you a question. What's going on? So that's that second part. Listen, acknowledge, ask. I'm going to ask differentiating questions. So I'm going to say, what's going on? Or they're going to say, I got this going on, or I got that going on. I don't have this much money, whatever it is. But you need to clarify the reason why they want to reduce the care first. Because if you don't clarify what their problem is, then you can't address it. Make sense so far? Now, the next thing I'm going to need to do is I'm going to use this form that we use, oops, there it is, which is on a scale of -10 to 0 to +10. They put that they thought they were a -4. They wanted to get to a +10, meaning they wanted to get as healthy as they could possibly be, and we know it because all their tests are clear, versus just feeling better at 0, which is comfort, right? And we would know that because all the tests aren't clear. So what I'm going to do is say, well, sure you can. What's up? And they go, oh, far out. Now, what I'm going to do is I'm going to say, well, let's talk about this for a moment. Originally, you thought you were a -4. You wanted to get to a +10. Where do you think you are now? Really important question to ask. Now, again, first thing I need to do is clarify the truth of where they're at. So if they say, well, I think I'm a +10, then I have to say, oh, I'm so glad we're having this conversation. Because you remember at the beginning, we said that you would start to feel better. You would get above that symptom line, and you'd start to feel more comfortable, and you'd be around a +1 or a +2. But if we redid all your tests, they wouldn't be clear. So do you think if we redid all your tests, your scans, your x-rays, all that stuff, that they would be clear at this time? And they'll go, oh, yeah, no, I don't think they will. Okay, so where do you think you truly are? Oh, yeah, I'm probably around a +2. Great. So are you happy at a +2? Well, what do you mean? Well, are you happy just being at a +2, or did you really want to resolve the problem? See, they've got to start to get truth and consequences about this. Do you really want to resolve the problem so that you can not only skydive again, but continue to skydive? So you need to go back to the whole why are they here in the first place thing. So if I'm going to give truth and consequences, I could just say, no, you can't stop care. The truth is, if you do, you're going to get worse. I could do that, but that's not going to work. So, well, sure you can. What's going on? Well, yeah, I'm kind of feeling better. Just doesn't feel like I need that much. All right, well, let's take a look. Originally, you thought you were here. You wanted to get to there. Where are you now? Far out. That is where you are now. I agree. Or it isn't, and help them understand where they are. So let me ask you a question. Where do you want to get to? Yeah, I still want to get to a plus 10. Oh, right, I do. Okay, so truth and consequences. If you want to get to a plus 10, if you want to resolve your problems, if you want to be able to skydive again and continue to skydive, then I would recommend you stay at twice a week. I do not believe you'll get there at once a week. Pretty simple once we've put it out here, right? Now they may say, well, I got to be honest with you, I'm really happy where I'm at. I'm feeling really good. Then truth and consequences are a bit different. So you need to be honest about what to expect over time. So what should they expect over time? If they go down from twice a week to once a week, do you still think they're going to get up to a plus 10? No. And they just said, I'm okay at a plus 2. So do you believe that once a week will maintain them at a plus 2? If the answer to that is yes, then we now have a new agreement, right? Cool. Stay at once a week, probably get you up to a plus 2, plus 3, plus 4, and that's where it's going to stay, right? But you need to be clear about it. You need to be honest about it. Now, if you're not getting them up to optimal health and they're not coming in enough to deal with the amount of damage, your repair versus your damage, then what's going to happen is they're going to eventually go down and they're going to relapse. And then do I need to be honest about that? Yes. Now, can I say 100% you're going to relapse? Probably not, but I can say, look, with what I've seen over the years, the odds are if you're not coming in this much, you're probably going to relapse. And then when you do, you'll need to get several in a row to get feeling better again, and we'll get you up to here. But then you'll drop down again and you'll relapse, and eventually what happens is we get past the point of no return. Is it true that if they're not coming in enough and they wait till they crash and then you adjust them and then they feel better and they wait till they crash, are things progressively worsening over time? Yeah, because joints are no longer gliding, they're grinding. And then we're laying down calcium and affecting the nervous system and all that kind of stuff. So whatever your truth and consequences is, you have to have with them. So, can I reduce my care? Sure you can. What's going on? Yeah, feeling better, blah, blah, blah. Great. So where do you think you are? Great. Where do you want to get to? Great. So do you still want to get to there? In that case, I wouldn't recommend that you reduce your care. But I really need to reduce my care because it's a financial issue. And I just can't make it in that much. Far out, I completely understand that. In that case, do I now say, you can go ahead and reduce your care and you're still going to get the same results you were hoping for? No, that's called lying. I mean, unless, of course, you do believe that they can get there. But you need to be honest with them, truth and consequences. So in that case, and I understand, you need to reduce care. You can't afford that much. I completely understand it. Then most likely this is what will get you. And then you have to explain what that means and how you're going to measure it, right? And plus 10 means you're as healthy as you can get. And we know because all your tests are clear, or they're going to be as clear as we can get them. Plus 6, excellent health. Do I expect your range of motion clear? Yeah. Do I expect your posture clear? Yeah. Do I expect you feeling better? Yes. Do I expect your scans clear? Probably not. I don't think that. What about your x-rays? So you need to do to be truth and consequences with them and clarify what your truth is. So I hope you found that of value. If you haven't read this book yet, 8 Steps to Get Your Patients to Happily Stay, Pay, and Refer for a Lifetime, you can click on that link and go ahead and download it. It's a really good book. It goes through, so really everything you need to know. And then there's tons of great information. There's a bonus section where you get to download a bunch of great stuff. So I hope that you'll do that. And also, if you have any questions that you would like me to address on video like this, I'd be happy to do it. Just flip me an email, Dr. Rosen, DRROSEN at theohcsystem.com. Flip me an email. I'll be happy to answer it specifically for you. You want to help your patients get healthy and stay healthy for a lifetime versus just out of pain. We can help. As always, much love and aloha. Bye, gang.